Hey everyone! Today, we're diving into a really high-yield topic for your hematology exams, the Sickling test. We're going to cover everything from the basic principle all the way to the key Viva questions you absolutely need to nail. So, let's get right into it. So, imagine you're in the lab and you need a fast, simple way to see if a patient's blood has sickle cell hemoglobin. How do you do it? Well, the answer lies in a pretty clever little procedure called the Sickling test, and that is exactly what we are breaking down today. Here's our game plan. We'll start with the core principle, then walk through the lab procedure, we'll look at how to interpret the results and, this is super important, cover the crucial limitations. Then we'll compare it to confirmatory tests and wrap it all up with some rapid-fire revision points to make sure it all sticks. Okay, first up, the core principle. To really get this test, you have to start with the why. What is actually happening inside these red blood cells on a molecular level? So what is it really? At its heart, the Sickling test is a screening tool. That's it. Its one and only job is to tell us if that abnormal hemoglobin S, or HbS, is present in a patient's red cells. It's fast, it's simple, and it's designed to answer just that one specific question. And here's the fundamental difference in how these molecules behave. Normal hemoglobin A, it stays dissolved and happy, keeping the cell nice and flexible, even when oxygen levels drop. But hemoglobin S, that's a whole different story. When oxygen is low, it starts to crystallize and stack together. It polymerizes, forming these long, rigid rods that literally force the entire red blood cell to change its shape. Think of it like a domino effect. First, we create a low oxygen or hypoxic environment on purpose. This is the trigger. That trigger causes the HbS molecules to polymerize, stacking up into those stiff rods. And then, those rods physically push and distort the cell from that flexible disc into the classic rigid sickle shape. And that's the exact change we're looking for under the microscope. So, we get the theory. Now let's get practical. How do we actually make this sickling reaction happen on a glass slide in the lab? The procedure itself is pretty straightforward. You put a drop of blood on a slide, add a drop of your reagent, mix it, and pop on a cover slip. Now here's the most critical step. You have to seal the edges of that cover slip, maybe with some petroleum jelly or nail polish. This creates an airtight seal, which is absolutely essential for keeping the oxygen out and letting the reaction happen. After about 10 to 30 minutes, it's ready for a look. Now, the real star of this show is the reagent, 2% sodium metabisulfite. This chemical is a powerful reducing agent. All that means in this context is that it's super greedy for oxygen. It gobbles up all the dissolved oxygen in that drop of blood almost instantly. This is how we artificially create the severe hypoxic conditions needed to force any HbS to show itself by polymerizing. Okay, we've done the test, we've waited patiently, now it's time for the payoff. Let's see what we're looking for under the microscope and what it all means. And the beautiful thing is, the interpretation couldn't be more direct. If you look in the microscope and see those classic crescent or holly leaf-shaped cells, the test is positive. It means HbS is present, simple as that. If all the cells still look like normal, round biconcave discs, the test is negative, no HbS. It's a very clear visual answer. All right, let's move on to what is arguably the most important section for your exams. Knowing what a test can't do is often more important than knowing what it can. So let's talk limitations. And look, if you remember just one thing from this entire explainer, please make it this. The Sickling test is a screening test. It is not a confirmatory or diagnostic test. A positive result is just the beginning of the investigation. It is never the final answer. So what can it do? Well, first, it can't tell you the difference between sickle cell trait, where you have one copy of the gene, and sickle cell disease, where you have two copies. Both will give you a positive result. Second, it's pretty unreliable in newborns. And why is that? Because babies have tons of fetal hemoglobin, or HbF, floating around. HbF doesn't sickle, so it can actually hide the presence of HbS, giving you a false negative. This is a classic exam question, so make sure you remember it. So, this brings us to the next logical question, right? If the Sickling test is just a screen, what's next? What do we do with a positive result? Let's zoom out and look at the whole diagnostic pathway. This comparison is just golden. The Sickling test asks a very simple yes or no question. Is HbS here? That's it. Confirmatory tests like hemoglobin electrophoresis or HPLC answer a much more detailed and useful question. Okay, how much of each type of hemoglobin is here? By quantifying the amounts of HbA, HbS, and even HbF, these tests can definitively tell you if you're looking at sickle cell trait or sickle cell disease. All right, let's pull everything together for a quick revision session. These are the absolute must-know facts that you should have on the tip of your tongue, ready for any Viva or practical exam. Let's lock these 5 points in. Number 1, it's a screening test, not confirmatory. 2, the principle is HbS polymerization under induced hypoxia. 3, the key reagent is 2% sodium metabisulfate. 4, a positive result just tells you HbS is present. It doesn't distinguish between trait and disease. And number 5, its biggest limitation, it's unreliable in newborns because of those high levels of fetal hemoglobin. So I'll leave you with a classic Viva question that ties this all together. Why is the Sickling test often unreliable in an infant younger than 6 months old? Well, the answer, as we've just discussed, is that the really high concentration of fetal hemoglobin, HbF, actually gets in the way. It interferes with the polymerization of HbS, essentially masking its presence and creating a very real risk of a false negative result. Understanding that mechanism is really the key to mastering this topic.